All right.
So first, thank you so much, Dr. Albright, for coming on the show. This has been so great. You and I have had a relationship for really, I think, more than a decade now.
Yeah.
But you, I think, are kind of a hidden gem right now in the Middletown community. And so, what I wanted to do is get you on the show, get people to have a chance to get to know you a little bit, because as you probably know, in medicine, you have a problem, you don't know your doctor until you need a doctor, and then you don't know who to go to. So I want to kind of head that off at the beginning and just say, tell us a little bit about yourself. So let's start there. So tell me, kind of from the beginning, like, what got you interested in medicine in the first place? Why did you choose that as a career?
Yeah. So I had no one in my family that did medicine at all. And
Wow.
so I knew I wanted to do something where help people and treat people. So initially I went into nursing and
Okay.
I did a few years of nursing, got my bachelor's of nursing, and then realized, well, I really like this. So wanted to do the next step and went to medical school. And in medical school, I had no idea what I wanted to do in there. And so as we were going through all the different rotations, sports medicine and orthopedics certainly stuck out for me as something that I really enjoyed. And so that's what led me to do a family medicine residency and then ultimately a sports medicine fellowship, which
Wow.
landed me in Middletown.
Now, were you involved in sports growing up? Like, I hardly ever played any sports growing up. I was more on the artistic side of things, but I became a physical therapist because I was obsessed with biomechanics and physical fitness and all of that. What drew you to sports medicine specifically?
Yeah, really it was the just the anatomy and being able to figure out uh, the way things worked and how things uh, were injured. And so I played a lot of sports growing up, did 10 years of football, had multiple injuries. And so maybe that somewhat catapulted me to leaning more towards sports medicine and orthopedics. Um, because certainly I spent a lot of time in doctor's offices growing up. So, but I think it was just more of, just being able to connect the dots and, working more with the hands and just listening to other athletes' stories, I think, is what really drew me into the field that I'm in.
It's funny you say that because I say the same thing. Like, it's the creative aspect, it's the problem solving. Like, I love to hear the story and try to dig deeper to figure out what's going on, and so that is what's so fulfilling to me. And then, of course, putting together the solution to help the person from where they are to where they want to be. So I can tell you that over the decade that we've known each other, whenever I bring up the fact that I know a physician, he's a non-surgical orthopedic, everybody's like, what is that? How does that even happen? What does that mean? So how do you describe kind of the fact that you don't do surgery, but you're still an orthopedic specialist, sports medicine, kind of, how do you describe what you do?
Yeah, that's a good point because I still get that even 15 years later in the office. People are, what? You don't do surgery?
Right.
So it is kind of a little niche subset of medicine, and it's where the sports medicine fellowship fell into after doing a family medicine residency. The majority of the time, about 85% of the stuff we see in the office does not need surgery,
Yeah.
and so it just needs diagnostic and a therapeutic approach of, well, how are we going to treat this without having to go to the operating room? And so I think for the majority of folks, that certainly works. And, there are times when obviously people do need surgery, but, that's actually more, in the minority.
Now, is there a distinction you would bring up between if somebody heard of a physiatrist versus what you do? How do you differentiate those two?
Yeah, so I think the main difference is I see the more breadth of orthopedics. So I'll deal with fractures as well as sprains, strains. Whereas physiatry, they will do more of, I think spine is more of their niche, and they will do EMG testing,
Right.
and um, they'll deal with prosthetics, stroke rehab. Whereas I'm more in the musculoskeletal athletic population.
Okay. And so let me ask you from this perspective, for somebody who's sitting at home right now, who's searching their problem on YouTube, searching Google, looking for a solution, I'm going to ask you a two-part question. So what is the biggest volume, the most common condition you typically see in the office? But then I also want to know, like, who's that person that's sitting at home right now who you know should come in to see you, but they don't know they should come in to see you. Like, they don't even know that you exist. They don't know that you can help them. First, what's the most common condition, and then who's really the person that needs to get into your office the most?
Yeah. So probably the most common condition by far is arthritis.
Okay.
And whether that be knee arthritis, basilar joint arthritis, just arthritis in general. And that's probably the most common that I see. And, certainly the population that I have in the office can be more towards the elderly, but, we see, at least in my practice, I'll see, infants all the way up to, geriatric.
Right.
And so, initially, certainly my practice was set up more for, kind of that athletic population. But as time has gone on, it certainly manifested more into just general musculoskeletal conditions, especially soft tissue disorders, things of that nature.
Okay. So who is that person that, you know, probably isn't thinking about coming to see you, but you is really the person who should come to see you?
Yeah. So I think, somebody that has had, a nagging injury or just some, uh, I get a lot of odd problems that come into the office where they're not sure who to see, um, and or what to do about it. So, they have a joint ache or pain or some, you know, odd symptom, that involves a joint, muscle, tendon. Certainly, that I enjoy seeing that just because it really is challenging and you know leads to a lot of critical thinking and how to treat that
Right.
problem.
Right. Okay, I'm going to pause this a sec. So when somebody does, one of the stories we hear constantly, now we're talking kind of pre-COVID and now in COVID, but the biggest barrier most of my clients have is they develop a problem. The problem's been persisting for a while. They're getting frustrated. It's not getting better on its own. Finally, they decide, I'm going to do something about it. They call an office and it's 3 months before they can get in. On average, what is the time frame? Like, if I'm in the backyard playing with my boys and I sprain a shoulder, I want to get in to see you, what are we talking about? Are we talking about months, weeks? How does that work in terms of time frame?
um Hours to a day
What?
at most.
Wow. Okay. And
Yeah.
I
So
assume you accept all the insurance providers locally.
yeah, yeah.
Okay. And the best way for somebody to connect or schedule is to call the office?
That is the most direct way, especially if they want to be seen right away. We always keep slots open for that day, or if we're full, then our phone folks are very apt at coming back and asking us if we can slide this person in, and we always do. So getting
Awesome.
into our office is not an issue.
And so what I'll do is in the show notes and in the description below, I'll go ahead and post all the contact information for the office and the
Okay.
telephone number and everything. I know another common question people have is like, and truthfully, how do you, if it was your mom or dad, your wife, your brother, sister, anybody related to you, how do you tell them when to decide, do I go to an emergency room? Do I go to an urgent care? Or do I go to you? Like, what's the criteria for that?
Yeah. So I think the biggest criteria to go to the emergency room for what I deal with is obviously if there's a bone sticking out of the skin, go to the
Okay.
emergency room. Um, or if it's in a weekend and there is something that is, pretty painful, but there was no gruesome injury, but it just needs more urgent attention. That's when, okay, maybe go to the urgent care. But for the majority, I would say 95% of the time, it can wait till that next morning to be seen in our office.
Okay, and you guys have imaging on site, and you guys can manage medications and prescriptions and all of that kind of stuff, right?
Yeah, so we have X-ray on site, and we also have an MRI machine, and then I do diagnostic ultrasound as well. So
What is that?
it's all
Explain
readily
that to me.
available. I'm sorry.
Explain that to me. What's
Yeah.
diagnostic ultrasound?
So diagnostic ultrasound is, what is used. It's machine used for when look at babies in the womb. But I use it to look at soft tissue structures such as rotator cuffs, tennis elbow, things of that nature that can be at the bedside without having to do any additional imaging, such as an MRI.
Okay. Are there so that's something that you could do in the office during a session, doesn't need a special trip, doesn't need to go out to a surgical center or anything like that?
Correct. I just do it right in the room,
Wow,
right at
awesome.
the point of care. Yeah.
Let me ask you another question that comes up for me with my clients in the clinic all the time. So often, as a matter of fact, today I was treating an individual who had a total knee replacement about 5 weeks ago. She's doing phenomenal. Everything is excellent. Now she's planning on having a second total knee replacement on the other side sometime later this year. She's kind of on the fence about it. She's certainly not sure whether it's something she needs. She's looking for a second opinion. And we see this a lot in the clinic. They want a second opinion before jumping into the surgery. So, as a non surgical individual, is that something that a person could come to you either if they've had, because another problem that I see quite a bit is somebody's had a complication following a surgery. They haven't gotten to the outcome that they expected, and they just need some guidance. They need some help. They want to know, why does it still hurt? Why is it still swollen? Why is it still red? Is that something that that individual could schedule a session with you, come in for an evaluation, assessment, and kind of get what I would consider a non-partial opinion on the situation, since you're not the one doing the surgery?
Yeah, absolutely. I see that several times a day, actually. And
Right.
so, it's one of those where, yeah, folks will come in and, they're not sure if they want that new knee yet, or, deciding on whether or not what type of surgery they want. It's something that, very comfortable dealing with. And yeah, non-partial judgment, because I don't really care if they have the surgery or not, because I don't do it. And
Right.
so it's not anything that I gain, monetarily from that. I just want to make sure it's the right thing for the patient.
Okay. Well, that is awesome. Thank you so much for your time. What I'll do, like I said, is I'll put your contact information in the video description below and in the notes. If anybody has these kinds of questions, and like me, I'm sitting here, I've got a nephew that just had surgery, and we're Googling stuff and trying to look stuff up. But the reality is there's just a flood of information out there. Who knows what's good, what's not,
Yeah.
where it's coming from. But for the community to understand, right here in town, we have somebody like you who is an MD, who's done your residencies and all the required education. You specialize in sports medicine. And we could literally say, hey, you know what? I don't have to worry about feeling like this person just is going to go straight to surgery no matter what. And I can get my orthopedic questions, my pain questions, my frustrations answered in a single session. And so I think it's so great. And that was why I wanted you on the program, so that we could get the word out to say, look, this is available right here in town right now. So thank you so much for being on the show. Hang on a sec before we wrap up for the conclusion. Do you have anything you wanted to add?
I do not. I just appreciate the opportunity, and I
Absolutely.
appreciate it.
Absolutely. So hang on a sec.
Thank you.